بسم الله الرحمن الرحيم. اليوم حنتكلم عن طريقة سحب الدم من الوريد أو من أي وعاء دموي. عندنا الأوعية الدموية اللي هي شرايين وأوردة وشعيرات دموية اللي هم ثلاثة. خلاص commonly هنا we take a blood sample from a vein، لكن you can need to take it from a blood for certain investigations. arterial blood sample. from the base عندنا في الارم commonly في الاريا بتاعت الكيوبيتال الفصة عندنا 3 main veins اللي هم commonly اللي احنا بنلقاه في الميد لاين اللي هو اسمه الميديان كيوبيتال فين، واحنا ممكن نشوفه هنا ميديان كيوبيتال فين لينكينج اللي هم ده الفين الثاني ده الفين الثالث. الفين الثاني اللي هو في الاتجاه بتاع الراديال اللي هو بيسموه الكيفاليك فين. الفين ده اسمه البازيلر فين. خلاص؟ you have to be sure البازيلر فين. you have to be sure the vein you want to take a blood from it is very visible. clear. إذا كان ما clear بنستخدم احنا commonly التورنيكات will use this vision in the blood will be blood vessel or vein will be distended by using this tourniquet. So we apply the tourniquet around above the area you want to take the sample from. If you want to take from the cubital fossa, you apply the tourniquet above biceps. If you want to take it from the hand, dorsum, so you apply the tourniquet above this area. Number one, after taking consent from the patient and you describe the procedure you want to do for this patient, so you apply the tourniquet. After the tourniquet you do the antiseptic massage بتاعنا بالانتسبتيك في الاريا المعينة اللي you want to take a sample from it. Then after that you wear the gloves and you remove the cover of the needle. So you take the needle like that and you have to be sure that the needle is applied well or fixed to the tube like that. And then you remove the cap. After that you have to be sure that the sharp edge is pointed upwards. شايفينه؟ this edge should be pointed upwards. خلاص؟ بعد ما نتأكد إنه pointed upwards الكفر ده don't forget it to be in to be ready for the coverage again after you remove the sample. Then you apply your needle parallel to the vein and about 20 to 40 degree from the vein. خلاص بعد السواب بعد الجلوفز. Then you fix the area you want to remove the sample from. Then you introduce خلاص you introduce the needle 20 degree to 40 degree inside the vein. Then like that. Once you introduce this inside, so you remove your finger and you pull the vein blood inside the city like that. After you take the sample 2 cc 4 cc what do you want, then you have to take the cotton. عندنا cotton فلنفرض دي القطن بتاعتنا. خلاص you have to press the edge of the jelly and then you remove gently the syringe like that, and then you ask the patient to press the area, and then you take the cup. Either you take it like that or you take it like that. You have to close this syringe or needle gently, slowly, without damaging your fingers, without breaking your fingers, like that. After that, you have to label this. Labeling after covering the wound by using the plastic. So you cover this wound by the plast, and then after that you label this, putting the name of the patient, the age of the patient, and the other descriptions that notify this patient. إذا كان عند غرفة معينة فايل أي حاجة notify, and you mention this is a venous blood, not artery. And then this will be sent to the lab with a request. This is for culture, for كده, for hemoglobin. What do you want? After that, you send the patient, and you have to, after finishing, you have to dispose all these in a certain place, specifically the disposable or disposal materials. A very important point that is when you do the cleaning with antiseptic, you have to be sure that before introducing the syringe or the needle, you have to be sure that the area is dried. Because if you introduce this alcohol inside the sample, this will change the result. Very important. With the points المهمة. You have to be sure everything is done well. Don't damage yourself, and don't to allow the blood to come or to be inside you or around the area of the procedure. Any question?